and welcome to WNHH-FM's Dateline New Haven. I'm your host, Paul Bass, inviting you to look behind the headlines on the stories that make New Haven tick. Well, the big story in town is the coronavirus. We're in the middle of a pandemic, and today we're pleased to have the person who is the captain of the government ship, helping us navigate these troubled waters and these troubled times. Fancy way of saying welcome, Mayor Justin Elicker. Thanks for coming on the Dateline New Haven today.
Thanks for having me, Paul. Always happy to be here.
Yeah, it's fun. I get to see you in the afternoon through Zoom with that same background, and now we're back in the morning. Justin, before we get to the coronavirus, I told you I wanted to ask you about last night's budget vote by the Board of Alders. They amended your proposed budget. A committee did. So the full Board of Alders is going to take it up in the end of the month. I think it's a pretty good guess that it'll stay pretty much the same way. They cut several $1 million out of your spending. I don't think they told you what to cut. They just said have them cut $1 million Board of Ed, trimmed your mill rate increase, and then added a new line that you had gotten rid of in the budget called the Revenue Initiative, meaning money we hope comes out that we don't have. They want $2.5 million more from Yale to help seal the budget. Are you okay with the changes last night?
So first of all, having been in the shoes of the Board of Alders about 6 or 7 years ago, because I was on the Board of Alders myself, I know that the members of the Board of Alders are really trying to do the right thing, are working very hard with their hearts in the right place to balance what the burden on the taxpayers, and also making sure that the city is able to provide services that are adequate for so many of the challenges that we face in the city. So I know they're trying to do the right thing. I'm very concerned about the proposed cuts. My team worked very, very hard, and I worked very, very hard to find as many efficiencies to make cuts that would minimize impact to services, and to balance that with making sure that we have taxes that aren't that are reasonable. New Haven already has high taxes, and I, of all people, did not want to raise taxes this year. I think that we came up with a pretty successful proposal to the board. What I'm concerned about is that we explored the potential of layoffs. We explored furloughs. We explored a lot of other different ways that are often raised to reduce expenditures, and found that oftentimes those choices are much more complicated than one thinks, may have unintended impacts, and actually don't save as much money as one would like. And I'm concerned that the depth of the cuts that the Board of Alders has proposed will certainly lead to layoffs, will dramatically decrease what are already very significantly stretched city services. You know, I propose cutting 80 positions. The police department, currently our staffing is at a low, and the places where we really have the ability to cut, because it's where our most money is spent, are not debt and pension and healthcare payments. Those are pretty much fixed. They are police and fire and Board of Ed. All the other components of the budget, you know, whether it's parks or finance or public works, are a very small percentage of our overall costs.
How small?
I don't have the number right in front of me, but you know, things like libraries and parks are tiny, and I have to get you those numbers compared to.
Or maybe you could just say police and fire. Do you know how much police and fire constitute?
Not off the top of my head, but I'm happy to pull it up.
But you're saying that the bulk, what this is going to mean is fewer cops and firefighters, basically, and teachers? Layoffs?
It's going to be fewer of everything.
Mm-hmm.
Fewer of everything. And I think that everyone needs to understand, and you know, I was on the board for a long time, and I for 4 years, and I remember thinking, oh, they'll find the money somewhere. When I proposed a cut, the then DeStefano administration will find the money somewhere. um, there's not a lot of magic money out there, and and I am very, very motivated to find that money if it exists. And you know, I think people have to be realistic. We've got a serious financial problem. We can't do budget gimmicks anymore, and because you know, at some point they stop working, and there's legitimately a choice between a tax increase and a service decrease. And that's a policy conversation we should have. And my team has been looking at this for months now. But people have to understand that at the end of the day, the funding needs to come from somewhere. I've been working hard to try to get more money from the state, and I've clearly been working very hard to try to get more money from
Let me ask you this:
our nonprofits.
they didn't specify the cuts, so basically, have they made the choice? Have they said? You said the choice is at this point between tax increases or service decreases and layoffs, which end up saving you less than you think. So it has to be more layoffs because people get severance and that kind of stuff.
Yeah, so
Um,
we're at unemployment. So we're basically charged to pay around 66% of the cost of unemployment because
mhm.
we're self-insured there. So you lay someone off and you get a very minimal savings in the short term.
So you're saying basically, did they make the choice last night? Even though they didn't tell you what to cut, did they make a choice between tax cuts and layoffs and basically chose a lot of layoffs?
Well, so yes, I don't know as the alders. Um, I have heard the um, the impression that furloughs would get us the kind of money that we need to close that gap. Uh, and in on this item in particular, uh, so furloughs, we can't furlough police, we can't furlough fire.
Under the contract?
Well, because it would just increase our overtime.
Mm.
And so if people want to have even close to the existing um, uh, services. With fire, we've got minimum manning, so we're legally required to have firefighters on duty. So you just can't go to those two places. The Board of Education already included in their proposal of how to reach my budget, which had a $3.5 million increase for the Board of Ed. They already included furloughs in their path to getting there. Um, and so the remaining funding available for furloughs is through a very limited number of employees. So the number of days that we would have to furlough people is very, very high, and uh, would and the unions also have to agree to that. Um, and so I understand that furloughs, and we explored furloughs. Furloughs is one option. It just doesn't get to that number.
And so
Um,
what are you gonna do? You're gonna veto it if it goes in this way?
well, the Board of Alders hasn't finalized
Mhm.
their vote. I'm having conversations with them and assessing the situation.
And then, what about this revenue enhancement? Now, do I have the history right? The history, as I understand it, is that there's this line called revenue initiative, which means money we don't have that we hope we get, and we put that in a budget. That Tony Hart, when she was mayor, put 18.6 million, saying we hope to get 18.6 million we don't have now. The alders approved it. Zero of those dollars came in, so then we raised taxes 11%. The next year, we said $6.1 million in revenue initiative, meaning money we don't have. We hope someone will give us. We got 3 million. This year, you put zero in that line. And the alders last night said we're going to get 2.5 million voluntarily from Yale, more than what they're giving us. And that's partly how they solved it. Do you agree with that?
Uh, I very intentionally didn't include money in the revenue initiative line item um, because I think it's difficult for us uh, to rely on the revenue from an unknown source. Frankly, I also think that expecting Yale to give just $2.5 million more is is way underestimating what Yale should actually give. And I'm not saying that the Board of Alders uh, believes that Yale should only give $2.5 million more.
But do you
Um,
think that it's gonna have any impact? Do you think putting that in a line item will lead to Yale giving you 2.5 million more dollars?
I don't think that's the way to approach it.
Okay. So anyway, you're listening to Mayor Justin Elicker in Dateline, New Haven. We're starting to get a lot of comments. We want to pivot to coronavirus. Can I just read the comments and you can see if you want to answer? You could pick ones you want to answer for now, and then we'll roll, Justin.
Sure.
Bob, and thanks everybody. Bob McCormick says, I know COVID-19 has been your top priority, but what about all the shootings in the city? Do you want to quickly say something about that?
I can tell you, and the chief would testify to this, that we are in daily communication about the concerns around violence in the city. Overall, our crime has gone down. However, one of the challenges with COVID is that it's more difficult for in particular for younger people that are at risk, for our street outreach workers and police officers that engage with young people very proactively to do so. They've been doing so more remotely with phone calls and things like that, but it's much more difficult for them to physically interact with the young people that may be at risk. So the short answer is yes, very concerned about it. And the young people are in school, and there's the chief has we've had some successes with catching some individuals that have been involved. We've got more work to do there, and it's a high priority.
All right. Claudia Lorraine Smith Barnes says Board of Ed administration is way overpaid and non-essential. Yale needs to give back to the city. COVID-19 requiring social distancing in classrooms, more smaller classes, more teachers. Okay, and this pivots to COVID-19. Rodney Williams says, let me first of all say I'm glad you and your family is okay. The minority community don't trust the process and how the virus was handled. Your team doesn't have people that look like us or are from our communities. Our communities will ride the storm out until community leaders are involved in a virus task force. The plan won't work. The city will not recover financially. It's impacting everyone, but we're not at the table. Thanks everyone for your comments. Do you want to respond to Rodney, and then we'll go
Yes,
into the.
so I don't. So first of all, I understand that obviously there's a major concern, and we've raised it in many press conferences, and worked very hard on the policy side to make sure that we're addressing the disproportionate impact of COVID-19 on communities of color, which is a phenomenon that's been happening around the nation. We've put up, unlike and more proactively than any other city in Connecticut, testing sites that are based in the community. We've worked very hard to address and support food distribution, homeless population, and done this in a very, very proactive way that impacts, that supports communities that are hurt the most. I don't think it's accurate to say that my administration doesn't reflect the community. My team worked very hard early on to ensure that we had a leadership that reflected the diversity of the city. I think that's important um, because we need many voices at the table. And if Rodney or anyone are interested in reaching out to me, my cell phone hasn't changed. It's 203-500-2969. I care very much about these issues and will continue to do so.
Greta Johnson, thank you. Greta Johnson says, how about the seniors in lockdown and handicapped? It seems they have been forgotten. Is there anything in the plan to have access to our senior parents? My mom is at Bella Vista and I'm not able to see her. And that's one of those, Greta, thank you. As you know, Justin, all over the country, we've been reading heartbreaking stories about nursing homes and other senior facilities where it's really, they decided it's not safe for older folks to have contact with other people because a lot of them will die fast. But then they're also in a lot of pain, and so are their families when they can't see each other. So what's your response to Greta?
I think this is a really tough issue. So we have a team, and we've actually partnered with our friends at the Board of Alders to call through all the seniors in the city, and we're slowly doing that. We've also done a lot of food distribution to seniors, so that we're supporting the individuals that, like Greta pointed out, are very vulnerable in the community. One thing also to mention is that Clifford Beers has a warm line So if people need someone to talk to or are looking for some support, they can call this warm line. I can look up the number while we're here. But I think that she's right. It's a real challenge, and a lot of seniors don't necessarily aren't as tech savvy as well, and so many of us are interacting with each other via Zoom and other ways, Skype, and many seniors don't have that accessibility. And so we've got to work hard to keep an eye on our neighbors and reach out to our community. City Hall is working really hard to do that, but I also think it's something that residents can do just proactively with their neighbors by calling up their neighbors, checking on them. They don't have to go physically close to seniors. Obviously, they're more impacted by COVID, not only because of the isolation, but because it's a much more vulnerable population and they can get very, very sick. So we all need to work together to make sure that our seniors are getting more attention.
Great assist. Thank God she's able to get around. But if she could not, this issue would become neglect. And Justin, we get to ask you questions every day at your press briefing, which we appreciate. You've done a great job at that with your daily press briefings, and we feel like it's civil and everyone gets to ask lots of questions. The information getting out there. So if it's all right with you, I do have a lot of questions for you, but I'd like to lead with the listeners who don't get to ask you questions every day.
Sure.
Levi Lewis says, um, hold on, I just lost Levi Lewis. Sorry about that. Sorry. I'm sorry, I'm learning this chat thing. I can't move it up. He's saying, what is the data on people survive? I think the good news is more encouraging. So he seems to be saying, is the focus really how many people have died, which has been a lot. We've had over 80 people, 77% of them are over 65, but not just died. Some people, we don't know yet the permanent impacts of this disease. But do you agree? I mean, that's kind of a really interesting position. And thank you, Levi, for that question. He's saying, should we be focusing more on the fact that most people aren't dying? I heard one person, I've had an argument with just someone the other day, a friend of mine, a friendly argument, who I said, like, we're not going to open for quite a while in our office at the Independent. We think people are opening too soon, that if you look at other countries, that we're going to backpedal on what's going to create a big demand at the hospitals. A lot of people get sick. Someone said to me, in the Hispanic community, everyone's I know is recovered. I said, well, the higher death rate in the Hispanic community. He said, but still, most people get it recovered. So is Levi right, the real story that people recover and that people are just exaggerating the threat here?
I think it's both, right? It's both. There's so many people that do go through the sickness. It's hard to go through it, but they come out. The majority of people come out the other end okay. But at the same time, you think of the number of community members that we've lost, and I call the loved ones of and family members of individuals that have passed, New Haven residents that have passed. And the quantity of people that we've lost just in the last 2 months is staggering.
Including a bunch of preachers. I mean, a lot of Black ministers are either very ill, some of them have passed, and we're hoping the others don't. But there are quite a few, as well as church leaders. This hurt the church really big.
And when you think about the very aggressive and proactive nature that we all took to practice social distancing, the casualties could have been much, much, much worse.
What about
And
moving forward? Are you concerned? You have some control, Justin Elicker. You got us social distancing early. I would argue New Haven would have, and so did Yale New Haven. They learned from what happened in Italy and in New York. I would argue, and maybe you don't agree, that New Haven would have had a lot more deaths if we hadn't done that. Are you concerned about what you don't control? That as we reopen, are you thinking the second wave might be worse if people rush back too fast?
I answered the question that I believe it was Tom Breen asked a couple of days ago about whether I'm concerned about this May 20th soft sort of incremental reopening that the governor's team's laid out. And I think the short answer is yes. When you think about, just take a barber, for example, who inherently has to break the social distancing guidelines. And our recommendations are to wear cloth masks in general, but because there's not enough N95 masks available, and the N95 masks are what keep you safe. The cloth masks help keep your germs away from other people. I'm concerned about what keeps that barber safe. What keeps the hairstylist safe when they have to interact with, say, 10 people in a day in very close quarters.
Probably more than 10.
Yeah,
And then you have several people
depends on the
buy.
popularity of the business, right? But
Yeah, and then they have 4 cutters often in one place, and you got air conditioner or heat blowing it around, and
right,
the hair blowers. They say that blows it around pretty fast.
yeah. So there's still a lot we don't know about the virus, but what we do know is it spreads easily and quickly, and I tend towards, from both a health perspective and an economic perspective, caution, because I know everyone wants to open up, but the economic consequences of opening up too quickly and then having to backpedal, uh, I think will be much more severe in the long run than if we're incrementally cautious.
All right, thanks. We listened to Mayor Justin Elicker here, taking the public's questions
These are
on
good questions.
WNWNHHFM's Dateline New Haven. Claudia Lorraine Smith Barnes, thank you for listening and writing in, Claudia. Says Whaley and Winthrop Avenue. I'm serious. Of concern for COVID infection. No mask wearing, sharing bottles, and not social distancing. Thank you, Claudia. Now, Justin, you see this around the country. Everyone's coming out, and maybe a lot of people wearing masks, but a lot aren't. And a lot of people are really close together. And sometimes you don't know because they might be 3 people in a family who are healthy together, but often it's clear that there are a lot of public places where they're not. How are we going to deal with that? Because I know you're not arresting people.
Yeah. So first of all, before I forget, I did put it in the chat screen, but the Clifford Beers warm line, if people are at home and just feeling like they need someone to talk to, is 203 So it's 287-2460. Uh, by and large, to your question, Paul, by and large, I've been really proud of how New Haven residents have responded to this thing. And in particular, you look at some of the pushback nationally that we've seen to the social distancing guidelines. New Haven residents have by and large, really stepped up. They're practicing social distancing. They're not gathering in large groups, and they're wearing their masks. And I think that is a testament to a lot of leadership in the city, encouraging people to do the right thing. Whether that is other political leaders at the state and local level, whether that's our local clergy. Um, people are encouraging residents to do the right thing. We've decided in City Hall not to aggressively enforce, and I think that's the right decision. What we typically do we'll send out a city hall employee, whether it's a police officer or a sanitarian, if we get a complaint and they encourage people to disperse, they encourage people to social distance, etc. They may encourage a place that is a restaurant to implement, or I'm sorry, a grocery store to implement some additional changes to make sure there's not too many people in the store, those sorts of things. And we'll continue to do that. People can report it to See Click Fix, or if they don't have access to the internet, they can call our health department hotline, 203-946-4949, to report incidents, and we'll send someone out to encourage people to disperse.
Okay, these are just comments. I don't know if you need to respond, but you can. Levi responded back. Let's be fair. Social distancing, there's some concerns and how police around the country are. So I think his point is that in New York, we saw in Black communities, police were beating up people who didn't have a mask. And in white communities, they were giving them masks. I don't think we've seen that here. Obviously, we're not arresting people.
No, we don't. Yeah, we don't
Yeah.
want that dynamic at all.
Greta wrote back, Mayor Elicker, I appreciate you and you've come in at a hard time, but you're a perfect fit for it. I love that you're open to talk and listen. Please be safe. Rodney says the virus burned through our communities before measures were taken to help prevent the spread. Yale had over 600 workers from our communities that might have impacted the spread of the virus before they said anything was wrong. Thank you, everybody, for the comments. Let's talk about that. You were elected mayor with a lot of ambitions, a lot of stuff you wanted to get done, stuff you wanted to change. None of them had to do with curbing a coronavirus. Though part of it had to do with fixing the health department. You brought new people in. What was the day when you said to yourself, Justin Elicker, oh boy, this is different. This is not what I signed up for. Do you remember a moment when you said the OSHIT?
There's been a number of privately. There's been a number of moments where I've said that, and I don't think anyone signed up for this, right? Nobody signed up for this, and I've gotten asked this question a lot about, you're mayor, you didn't sign up for this, but hospital workers didn't sign up for this, nursing home workers and leadership didn't sign up for
In a
this.
sense, you did. You wanted to be responsible for a city of 130,000 people. You wanted to lead it. You wanted to make the decisions that keep us safe, whatever that tends to be. But you don't know when a once in a century pandemic is going to hit you.
Right, right. So you're saying I got
No,
what was
no.
coming
I'm
to me.
saying that in one sense you did sign up, and in one
No,
sense you didn't.
I understand. But I think probably the moment when there wasn't like a moment. Um, there was every day it started to escalate. I think the moment when it became really real is when we canceled school.
Yeah.
Because
I remember that
canceling,
day because that happened so fast. It was first just one school and within, on the East Shore, and then it was suddenly every school.
yeah, we were going through the timeline of how things happened. And I think it was Nathan Hale was one day, and then it was either the next day or the day after we
It
closed
was the
all.
next. It was a Thursday and then a Friday.
Yeah, and we had a lot of meetings in between, um, and to talk about, is this the right decision? You remember when we canceled St. Patty's, and that was like, oh, that's something big. But then
Yeah.
the schools made it real, because all of a sudden there's 20,000 plus families that have to figure out how to take care of their kid at home.
Yeah.
That was a very significant decision, and that made it real.
Justin Elicker, WNHH-FM's Dateline New Haven, 103.5 FM, live streamed at newhavenindependent.org. We're talking about the story of the century, the challenge of the century for New Haven, which is to keep us alive and safe and together amid the worst pandemic since 1918. Mayor Justin Elicker has that job, and we're talking to him about that. Joey Monsanto says these things should have been done before, oh boy, my screen just went, as early as April 1st, day late and a dollar short. Jaywan says, Jaywan Carter, hi Jaywan, why should government buildings, City Hall, State Capitol, open after businesses? I think he's saying, are you going to yeah, that's a good question. You're sort of open, you're sort of not open, right?
Yeah, it's a little bit of both. So a lot of our staff is working from home. That can, right? We've distributed a lot of computers, and so a lot of staff is teleworking. And then you have most of our public works is back, most of our parks is back.
Meter
Police and
readers.
fire, police and fire have obviously been working full speed ahead. Teachers are working from home, as folks know. And then we have a lot of, because of food distribution, things like that, school workers that are still coming in. So in many ways, we've kind of been open the whole time, but we haven't been open to the public to come into City Hall.
Which might be Jaywan's point, right? Like if you want
Yeah,
to file a deed for real estate, you leave it in a box outside, if I'm correct.
yeah, yeah.
And if you want to go, you can't really come to the mayor's office or go have a meeting at LCI. Is that
Right.
going to change next week?
Not immediately. We're working on this, and it's similar to a lot of other office space type of environments where we're developing a plan to make sure that we're keeping our employees safe and keeping people that come into City Hall safe. I think that you're likely to see an incremental opening of different offices in City Hall. And what's probably going to happen is our first floor is going to start to become active. We need to do everything like put lines on the floor for people to line up 6 feet apart, to putting plexiglass up to keep some of our employees safe. There's a lot of work that goes into this. And of course, things are often more complicated and just take longer time because we want to make sure that we're involving our partners on the labor side to make sure that everyone's on the same page as we open up. But I think Jaywan has a good point. We've had a lot of conversations about making sure that we can uh, make government accessible to people.
Okay. Stan Cap says, open up the softball fields for adults. We can do it. That's a really good question. Justin, we like to give opinions in the press, but I really don't know what the heck I would do in your situation. Is it safe to have softball games and things like that?
So you catch the ball with your glove, and then you take it with your bare hand and grab the ball, and you maybe wiped your face with your hand before you grab the ball, and then you throw it to your friend, and they grab it and touch it too. And these details are really important. We've taken down the basketball nets because there's a lot of close contact, and people are all touching the same ball. So I believe me, I want to get out myself and interact with people myself. I think that these types of exercises are a healthy thing for our mental health, our physical health, but I think we just have to be really cautious and careful about how we do this.
Okay, let me whip because I'm not doing a great job just in toggling here with this chat function. Let me just read a lot of these. Sushi de Lejos, and thanks everybody for weighing in. Thanks for all that you do for New Haven Public Schools and the entire community. Claudia says opening up the state does not mean not wearing PPE. 85 people dead as of yesterday. Joy, most of the restaurants downtown are not licensed to serve outside. Can they use parking lots or sidewalks with no licenses? If I'm correct, Justin, the governor has a new order that's going to make it easier for you to allow people to go outside onto sidewalks and into parklit parking spaces, right?
Correct. So that doesn't mean the restaurants can just do this. There's a process, and they can work with City Hall to do this. Also, it's important for businesses that are planning on opening up under the governor's guidelines. They need to self-certify, and so they can't do it without going to the state's website. The state has a website that we put out in a lot of different places and self-certify.
Bud Mensch, will barbers have to change their face masks after every haircut?
I'm not the health director, but I think this is a really good question.
I think
Uh,
the answer is yes.
I think the
I
answer
did
should be yes.
research it. I could forget. I actually read it, but I don't have a great short-term memory. But I believe it's yes, but I have a feeling that everyone's gonna be looking into that. Brian Jenkins, the mayor is in an untenable situation, and thus far he seems to be handling the scourge admirably. Thank you, Brian Jenkins. Hope you're safe down there in Atlanta.
Brian.
Um, Brian Maxwell asked Justin Elicker, how do you encourage Yale University to reopen in the fall? I know there's risk, but it's minimal to college age students, and New Haven businesses really rely on the money that students provide.
Yeah.
Also, thank you for opening the walk up clinic in Dwight to better serve a community who maybe doesn't have cars. And for navigating leading in this very difficult time, two exclamation points. Thank you, Brian. Obviously, Yale's decision is not going to be based on what's good for our economy, but as Brian points out, this could be life or death for some local businesses. Well, and Yale yesterday announced that they're going to decide in July. They're making plans to start the semester both online and offline. Then they'll decide. It sounds like working the lab is going to open, so there will be human beings here, but the 5,000 plus undergraduates, we don't know. What do you think?
So a number of things. First of all, there's a difference between graduate school and undergraduate school. The undergraduate population is living in dorms. The undergraduate population uses cafeterias. So there's much less flexibility that Yale has to keep undergraduate students safe. And so I expect that Yale may consider treating the graduate population, which is living primarily like most folks in New Haven are, as far as they're living in apartments off campus. They are responsible for their own meals, those sorts of things. And so the graduate school population is a little bit more capable of self-isolating, practicing social distancing than the undergraduate population. So it's possible Yale may treat those two groups differently. I'm obviously very hopeful that it will be safe enough for the university and other universities to open up in the fall because of the significant economic impact that has on the city, and it will have a very negative impact if they don't. But I think that the thing that the city can do to make sure that we're as best as possible laying the groundwork for the university to open is to continue doing what we're actively doing, reducing cases, reducing people's exposure, getting the testing regime up and up and up so that we can have more and more people tested so there's less community spread in New Haven, because that is going to allow us to help keep fewer people in the hospital and ensure that the virus isn't spreading when hopefully Yale comes back physically to session.
And as to the listener's point, the listener said, well, college students can handle it better, but if they're carrying the virus into the
Oh,
stores they
correct.
go, then they kill us. School management, I've been hearing that they might be more willing to open, partly for what you said, that people live off campus, so that'll be good for the landlords. Um, Also, that building's pretty spacious and airy, and don't they have smaller classes? I mean, you went there. Am I wrong? Sounds like, to your point, a place like school management might be the easiest place to open, whereas the law school seems kind of not as much airflow, not as tall ceilings, things like that.
Yeah, I mean, it's also, you think of the population and the resources of Yale, it's pretty easy for them to do some classes online. say if there's a professor that may be particularly vulnerable because they're older in age or they may have some other health conditions, they may do some classes where they're remote and other classes where they're physically in the same space. One other thing that I keep hearing is universities talking about needing more space so that students can physically be in one space but social distance. And so it may be that they significantly reduce the number of students that are in a classroom so that students can be far apart. It may be that they use much larger spaces for classes so that students can stay far apart.
One thing they talked about, Justin, this morning, I read that Yale put out a letter about the status of its planning, that they're going to stretch the day longer when they assign classes so that you can have fewer. Tennille Nixon asking, I think this is a state question, will it be mandatory for correctional officers to wear masks? Well, you do have one or two correctional officers in your lockup at one Union Ave, but do you know
It
anything
is
about that?
mandatory for them to wear masks.
Okay. Greta again says universal precautions are going to be hard to follow in these kinds of places, gyms, parks, and people not thinking all the time. Ruthie Hosky, thanks for listening, everyone, and for giving these questions. Will our city taxes be increased? You had an increase that I think was 3%, was it? And then the Board of Alders last night, what?
3.5.
And then last night they halved it, right?
No, I think it's down to 0.75.
Less than a mil. Okay, so, but we're unclear. So there will probably be a tax increase. The question is how much, and it will not be major. I was calculating mine today. I think it's like $80 or $100. Marie Ackerman says, if and when the public schools open,
1.81%.
thank you. If and when the New Haven public schools open, will staff be provided with masks, any protective equipment or thermometers? Thank you so much. We appreciate all you're doing to keep all safe in our schools and community. And thanks to Marie.
I think that so public schools reopening is going to happen presumably in the fall. I would be lying if I said that we had a very solid plan right now about exactly how that would look. However, and thankfully we have some time to figure this out. However, I think that we can all safely uh, say that mask wearing will be typical. There will be changes in the way that that school is run, and that's both to keep kids and staff safe. And I think one of the things about the virus, and it actually came up on one of the questions earlier on, is kids and young people don't get significantly impacted by COVID-19, but they can be carriers. And so us just saying, the kids will be fine, that may be the case for most kids, but they're going to go home and give it to their grandmother. They're going to give it to their family members, and some of their family members may not be fine. So I think it's very important for us to make sure that we're implementing a lot of policies in schools, and it's going to be difficult to do, that minimize the spread.
Stan Cap says, thank you for answering my question. We shall get there someday. Be safe. I would say that's one statement that we can all agree about because everything else is confusing. Sabrina Williams says, good morning, Mayor Elicker. Thank you for your hard work in the city. Bud Mensch asks you, when are they giving out more face masks to business owners? And if yes, where? So you have a task force together in New Haven. Your business department is trying to figure out, because I mean, we've heard that from small businesses. They're telling us what we have to do, but not how we're going to get these face masks and other personal protective equipment. What do you have to say to Bud?
So we're working on this. We had one business mask giveaway. It was about a week ago. There were some businesses that signed up for it that weren't able to make it to that. So we provided separately masks for those businesses, and we'll continue to work on this. I do think that he has a good point that, we're so focused on this May 20th date, and that the governor's laid out, and a lot of businesses are not able to get the proper PPE. I know the state has secured a lot of PPE recently, and they are planning to help provide some of that PPE to a lot of the entities out there that really need it. We're talking with the state about how we can help distribute PPEs, and we'll definitely communicate with the business sector about that. And one other thing to add that I think is important, and I appreciate Paul, your article yesterday on it to help get out the word. We are continuing to expand our testing, and we're starting to test asymptomatic people. So up until now, most testing sites are only testing people with symptoms, but to really get that virus under control, we have to test a lot more people. And so we're encouraging people that are planning on doing this soft opening under the governor's guidelines, like barbershops, particularly those businesses that have close customer employee contact, to have their employees get tested. And they can do so at our Chapel Street site, which is at the corner of Chapel and Day Street. They have to sign up in advance. But that's just a way to make sure that you're reducing the likelihood of spreading the virus to your customers. And it also brings some certainty to your customers that it's a little bit of a safer environment to go into.
Connecticut Keith asked, not on this thread, but on the other thread in that article, the Abbott lab test that was being used a lot was mentioned in the New York Times yesterday as missing 50% of positives and giving 15% false results. Is that being used at the Long Wharf site and other sites?
So I took a look at that article. I think it was one study that came out about that.
And it's not been peer reviewed yet.
But obviously very, very concerning if that's the case, because I believe the CVS site uses that test, and what a problem if there's a lot of people that think they're negative and are positive and are spreading the virus. None of these tests are perfect, and different tests have different percentage of inaccuracies, but that kind of number would be staggering.
Have you learned anything new that you didn't know about what it's like to run New Haven and deal with the people who run Yale and Yale New Haven Hospital? What's your experience been, and what have you learned about it?
Wow, it's a big question. I think that this experience has affirmed a lot of the things that I knew about New Haven. Just thinking about how many people and how many organizations have stepped up in this time of crisis is inspiring. And I've been involved in a lot of different ways over my time here in the community, and the crisis really reveals character. Organizations like Downtown EV Soup Kitchen and Junta and Community Action Agency, and all these organizations are stepping up and in some cases actually putting themselves at risk to make sure that the community is getting the kind of support that they need. One thing that I've been so grateful for is the incredible work of my staff in City Hall. And that's everything from the refuse workers to the school nurses to our core team of leadership have been working just nonstop. I'll send an email to my corporation counsel at 11 p.m. at night, and I'll get a response at 11:05. And that is for almost all of our staff. People are working tirelessly because they really care about the community and they care about doing the right thing for their jobs.
Must really be bonding. There must people, you guys are working so intensely, so closely. What about Yale and Yale New Haven? Are they operating the way you expected before you came in?
It's a tough question. We've been in close collaboration with the hospital, and I've been grateful. I think there were some, initially, like with all entities, it took some, and internally as well, some time for us to get into the right cadence and the right communication structure so that we were on a regular basis connecting about the things we needed to connect on. And I think we have a pretty good line of communication with the hospital now. Of course, there's always more work to be done, but I think in general, it's been going quite well with our communication with the hospital. And Yale University as well. The university is trying to do the right thing. And as you've reported on and others have reported on, there's been some bumps along the way. I've always been quite clear that I think there's a lot more that the university needs to do for New Haven.
Who calls the shots there? I mean, who do you call up? In the old days, it was Rick Levin and Bruce Alexander. If people around New Haven want to get something done for certain matters, they called Alexander and something was done in 10 minutes. Once in a while, Levin. Is it the corporation? Does Peter Salovey make decisions? Do you have someone under Salovey who's really on top of things in New Haven?
I call Peter.
Mm-hmm. And does that go okay? Can he make decisions?
Yeah, I mean, that's my understanding.
All right. So Tennille Nixon, thanks you for answering her questions. She said at Carl Robinson, they're not wearing the masks. And Ronnie says he doesn't feel comfortable sending his two daughters to school. There's six grandchildren. We all have tough decisions like that. And thank you so much, everybody, for listening and sending in these great questions for the mayor. And Mayor Justin Elicker, thanks for coming in, sitting on the firing line, and taking the questions from the public. It's really been a pleasure.
Wouldn't be the
And I
first
wish
time.
the best to you and your family and your staff in continuing to help us all together navigate the crisis of COVID-19. Biggest challenge in our lifetimes, and we're going to get through it, hopefully, all together. I want to also thank Harry Drost, the miracle man behind the controls, WNHA station manager. And thanks, everybody, for listening in. We're going to take it out with the Afro-Semitic Experience, performing I Wish I Knew How It Would Feel to Be Free from the group CD, A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night long at WNHH, New Haven's home for community radio. There it is.
Thanks, Paul.
Thank you, Justin.